Alright, good evening everyone. I hope the biochemistry portion from the FMGE 2025 January examination was up to the mark, and I hope all of you will get this time 150 plus and this is over, right? So let's discuss FMGE Recall 2025 January biochemistry portion. The development of cataract in patients with diabetes is due to accumulation of which of the following substance in the lens? Since the question mentioned in a patient of diabetes mellitus, it is due to the accumulation of, in diabetics, there is accumulation of glucose, and when glucose accumulates, it is converted to sorbitol. This is by the action of the enzyme aldose reductase, and I am sure you all have got this right? So here we are spreading good news only. So yes, biochemistry was good news this time. So this is due to sorbitol. Another question, if there is any change in this question, if you find that some of the option is different, please tell me in the chat box. So let's see. Another question, a patient presents with bleeding gums, petechiae, there is poor wound healing and other related symptoms. I think probably in the examination corkscrew appearance of hair was also mentioned. That is also seen in vitamin C deficiency. It was not an image based question, and this is vitamin C deficiency. It is seen with vitamin C deficiency. Then we have here another question, which of the following is excreted in urine of patient with pentosuria? It is, the disorder is essential pentosuria, in which it is deficiency of an enzyme known as xylitol dehydrogenase. If this enzyme xylitol dehydrogenase is deficient, it will result in accumulation of xylulose. So it is accumulation of xylulose which is secreted in these patients' urine, and this will give positive Benedict's test. So I am discussing a little bit more so that others who are going to appear in the examination in the next batch, right, they can benefit from this. So yes, it is positive Benedict's test. Another question, a 2-year-old presents with bowed legs and there is normal calcium, high PTH. The probable diagnosis is there is hyperparathyroidism, but I do not know whether this is complete picture is given or not, right? In the question, if somebody can correct me, what is the complete question here so that we can discuss this, right, in detail. But because bowing of legs is given, it is rickets. It is rickets. So it is shown in rickets. Another question, a 4-day-old neonate presents with bilirubin with a value of 15 milligram per deciliter. This is higher. The most probable cause is physiological jaundice because it is a 4-day-old neonate. So it is under the less than 15 only. So around 15 milligram per deciliter, it can rise in a physiological jaundice case. During starvation, which of the following hormone is primarily produced to maintain the blood glucose levels? Now, when we are starving, the major hormone of action is always glucagon. Glucagon maintains the blood glucose all the time. Then, a patient presents with arthritis and arthroscopy reveals blackening of joints. Which enzyme deficiency is most likely responsible for this? And I know you all have marked homogeneticic acid oxidase deficiency. In this condition, homogeneticic acid will accumulate, which is converted to benzoquinone acetate. And I always correlate this with black colored Mercedes Benz so that we are able to remember that it will result in blackening of urine will be due to this benzoquinone acetate. So this is resulting in black colored urine. This is resulting in black colored urine. Another question, which of the following is deficient in mucopolysaccharidosis associated with Nettovic's disease. This was little atypical questions according to the FMGE standards, but this is enzyme. Here is, if enzyme was asked, then it is hyaluronidase, and if in the question what compound accumulates is asked, then it is hyaluronic acid. So it is hyaluronidase deficiency. Another question, which of the following amino acids primarily act as buffer in blood due to its ability to accept and donate protons at physiological pH? This here is seen in histidine. Histidine is the only amino acid whose dissociation constant is 6.1 and is nearest to the physiological pH of 7.4. And because it is nearest to the physiological pH, hence it is associated with, histidine is associated with best buffering capacity. Of all the amino acids, histidine has best buffering capacity. A patient with a history of strenuous exercise skipped a meal and later consumed alcohol at a party. Alcohol inhibits which of the following biochemical processes? I always say that this alcohol will be there in the examination. There will be a question related to alcohol in the examination. Probably there were more than these, and if somebody can recollect and tell it in the chat box, it will be good. So alcohol, it inhibits which of the following biochemical processes? Now alcohol, what it does is it will form lot of NADH, and more NADH, it will convert the oxaloacetate depletion will it cause. That means oxaloacetate will now be converted to malate. We will see in this enzyme malate dehydrogenase under TCA cycle. So because there is lot of consumption of oxaloacetate, there is depletion of oxaloacetate. Oxaloacetate is a major substrate to form glucose. In other words, there is no glucose and hence gluconeogenesis will not occur. So alcohol consumption depletes even on gluconeogenesis. Question: which of the following enzyme is dependent on vitamin C? Let's see if all the options were correct. If this was related to lysyl dehydrogenase, lysyl oxidase, prolyl hydroxylase, what was the fourth step? What was the fourth distractor? Whatever is it, the answer is prolyl hydroxylase. It is prolyl hydroxylase. Prolyl hydroxylase converts proline to hydroxyproline. It converts proline to hydroxyproline. More is hydroxylation, the more is stability of collagen. Collagen is stable because of hydrogen bonds, and more is hydroxyproline, more is the stability of collagen. This hydroxyl group is responsible for stability, and this will be seen for collagen. This enzyme here, prolyl hydroxylase, it is very important enzyme, and this has been discussed under vitamin C. You can find it under vitamin C. This hydroxylation requires vitamin C and iron. Deficiency of vitamin C will hence result in scurvy. Why? Because no hydroxylation. This is a classical example of post-translational modification resulting in poor post-translational modification in vitamin C deficiency is associated with bleeding gums. Which of the following enzyme is typically elevated in prostate cancer? This is a direct question. Acid phosphatase. Then A baby presents with clinical features. This is a repeat question. So many times it has been seen earlier. This is shown as a perioral rash. Either there will be rash around the oral surface, or it can be around the anal surface. So there is perianal or perioral fissures or rashes which are seen along the fissures, and this is accompanied by diarrhea. This is typical case of acrodermatitis enteropathica. This is associated with diarrhea that is seen in zinc deficiency, in mineral zinc deficiency. So it is seen with zinc deficiency. So this is a classical feature, particularly affecting in infancy. It is painful dermatitis, and most commonly it is confused with the rashes which is normally seen in the babies. So this is zinc deficiency. This is not a normal rash. This is a acrodermatitis rash due to zinc deficiency. Then a chronic alcoholic, another question on alcohol. A chronic alcoholic reported to have decreased intake of food with the last couple of months now presents with hypoglycemia. Probably it is some version of that original question only. What is the most likely cause of hypoglycemia? I guess in one of the options it can be mentioned, it was mentioned increased gluconeogenesis. It can be increased gluconeogenesis. So it is decreased gluconeogenesis. So it is seen with chronic alcoholics. NADH-NAD ratio is higher, which will result in consumption of oxaloacetate. Decrease in oxaloacetate is associated with decreased gluconeogenesis. Enzyme which is responsible for removal of triacyl glycerol from the chylomicron, or even if in the question it is VLDL, the enzyme is always lipoprotein lipase. This is the intravascular enzyme. It is present inside the blood vessels, and a must activator for this enzyme is ApoC2, which will activate this enzyme, and it will cause degradation of triacyl glycerol to glycerol and free fatty acids. Which is the best marker of apoptosis? Yes, this is phosphatidylserine. It is phosphatidylserine. Please note, phosphatidylserine is originally present on the inner side of the membrane. When it shows on the surface, that means that the cell is going to die. So it is a marker of apoptosis. Phosphatidylserine is it flips from the inner leaflet to the outer leaflet. That is a marker of, more is the concentration of phosphatidylserine on the outer leaflet, that is a marker of apoptosis. What test will be done in a patient before starting anti-malarial drugs who had a family history of hemolytic anemia? So this we must go for G6PD analysis, because G6PD can be, it is one of the precipitating or causative agent which can precipitate the hemolytic anemia in a person who is having G6PD deficiency, can be malarial drugs. So this anti-malarial drugs, so they can precipitate the hemolysis occurring due to G6PD deficiency, because they create an oxidative stress environment. And on G6PD deficiency, already patient is having high circulating hydrogen peroxide, which is converted to superoxide free radical. So more is superoxide formation, more is hemolysis, and hence this patient must be analyzed for G6PD. If option D can be suggested, so this here is G6PD analysis should be done. This is pyruvate kinase deficiency, hexokinase deficiency. These are enzymes of glycolysis. G6PD is the enzyme of HMP shunt. which produces NADPH, which is a protection against this formation of superoxide free radicals. Then, which of the following would best describe the control of an enzyme activity by phosphorylation and dephosphorylation? Whenever we are controlling an enzyme by phosphorylating it or by removing this phosphate, this we are adding a phosphate group by a covalent bond. Hence, this kind of modification is called covalent modification. So, with this, we have seen the questions that were asked in INICET biochemistry portion.